Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the muscles of mastications. So what are the muscles of mastications? The muscles of mastications are the temporalis, masseter, lateral pterygoid, and medial pterygoid. These are the muscles of mastication. What is their common characteristic? Okay, common features of the muscles of mastications. We can say the facts about the muscles of mastication. Muscles of mastication. Okay. All the muscles of mastications are developed from the first pharyngeal arch. So, all the muscles of mastication are developed from the first pharyngeal arch. Okay. All the muscles of mastications are innervated by the mandibular nerve, because mandibular nerve is the nerve for the first pharyngeal arch structures. All the muscles of mastication are innervated by mandibular nerve. Okay, you got that fact. Then all the muscles of mastication will act on the temporomandibular joint. On the temporomandibular joint. Okay, we got the facts about the muscles of mastication. They all are skeletal muscle. Okay, all of them are skeletal muscle. Okay, then we'll add one more, that is, all the muscles of mastication inserts to the mandible. Insert to the mandible. Okay, we got the facts about the muscles of mastication. We got that. Then we'll go to the individual muscles, their origin, insertion, nerve supply, and action. Okay. So first of all, we'll go to the temporalis muscle, temporalis or temporal muscle. Okay. Origin is from the temporal fossa, and the deep surface of the temporal fascia, deep surface of temporal fascia or fascia. Okay, we got the origin. Okay, so we got to the origin here. This is the site of origin of the temporalis muscle from the temporal fossa and from the deep surface of the temporal fascia. Okay, where does it inserts? Then we'll go to the insertion. Insertion to the coronoid process of the mandible. Okay. Anterior border of the coronoid process. Anterior border of the coronoid process. Extending to the third molar teeth. Okay, we got the origin here from temporal fossa and temporal fascia. Insertion to the coronoid process. This is the coronoid process here. Coronoid process going up to the third molar teeth along this. Okay, so we got the temporal. This is the coronoid process, and it insert here and go along this line up to the third molar teeth, almost to the third molar teeth. Okay, then got origin, insertion. Then we go to the nerve supply. Nerve supply, we have all the muscles of mastication, so innervated by the mandibular nerve. Here the nerve supply is from the deep temporal branch of the mandibular nerve. Nerve supply from deep temporal branch of the mandibular nerve. Okay, now we got origin, insertion, nerve supply, action. What is the action? It elevates the mandible. Action. Action, when we deal with action, we always insert the origin towards the we always pull the insertion towards the origin. So this is the insertion, this is the origin. If you pull the bone towards the origin, then it will close the jaw, that is that elevates the jaw and closes the jaw. That is the action of the temporalis. Okay, so elevates the mandible. That means it closes the jaw. We got the movement. Okay. posterior and the horizontal fibers are the retractor of the mandible. Okay, posterior and horizontal fibers of the temporalis muscle, okay, are first degree retractor of the mandible. So mandible is going back. Okay, mandible. We got the action of the temporalis muscle. Now we'll go to the action of the masseter muscle. Masseter. Okay. Masseter muscle. Our second muscle is the masseter muscle. This is a muscle of mastication, again from which arch it is coming. From the first pharyngeal arch. What is the nerve supply? Nerve supply is from the mandibular nerve, mesenteric branch of the mandibular nerve. Okay, we got that. We go to the origin again. Origin is from the zygomatic arch and the maxillary process of the zygomatic bone. So origin from the zygomatic arch and maxillary process of the zygomatic bone. Okay, we got the origin. Now we'll go to the insertion. Insertion of the masseter. Insertion is a big insertion on the mandible, here on the ramus of the mandible, on the lateral aspect of the ramus of the mandible, lower part of the cornoid process of the mandible, and the lateral aspect of the ramus of the mandible. Okay, we got that. So insertion, okay, lower part of the cornoid process of the mandible process and lateral surface of the ramus of the mandible. Okay, we got the insertion. Nerve supply or innervation from the mesenteric branch of the mandibular nerve. Branch of the mandibular nerve. Okay, of the mandibular nerve. We got the nerve supply, origin, insertion. Now, what is the function of masseter muscle? Again, we must know, we must pull the insertion towards the origin. Insertion is here, origin is here. Okay, so if we pull the insertion towards the origin, then what will happen? There will be elevation of the mandible. Okay, that will close the jaw. So muscle action, elevation of the mandible. Okay, that means it closes the jaw. Okay, we got the action. Then we have some fiber, those are superficial fiber, contribute to a limited contribution to the minimum protrusion of the mandible. Okay, some superficial fibers contribute in the protrusion of the jaw. We got that. Okay, so that means it help in protrusion of the mandible. You can say mandible in lieu of jaw, mandible. Okay, we got the action of the masseter. Now we go to the lateral pterygoid muscle. Okay, lateral pterygoid muscle. Lateral pterygoid muscle. Okay, you can easily remember lateral pterygoid muscle. So it is related to the pterygoid plate, the lateral pterygoid plate. Its origin from lateral surface of the lateral pterygoid plate. Origin lateral surface of the lateral pterygoid plate. Okay, we got that. Then it also takes origin from the crest of infratemporal surface and crest of the determining the sphenoid bone. It also takes origin from the infratemporal surface and crest of the sphenoid bone. Okay, we got that origin. So this is our pterygoid plate, lateral pterygoid plate, medial pterygoid plate. So lateral surface will get the lateral pterygoid. Lateral pterygoid muscle. Also it takes origin from the infratemporal surface of the greater wing of the sphenoid bone and also from the crest of the sphenoid bone. Okay, we got the lateral pterygoid muscle. What is the action? Action, you must remember that action. It helps, it pushes the mandible forward and help in the depression of the mandible. It protracts. If it protracts, if it push that mandible forward, then the posterior fiber of the temporalis can help to depress the mandible, protracts and depress the mandible. Okay, so it protracts and depresses the chin, the mandible, so it opens the mouth. So opens the mouth. It depresses the chin. Chin is this part. Unilaterally, if it works, it swings jaw towards contralateral side. Alternate movement of the muscle. What they do, it help in lateral chewing movement. Okay, so it help in, so alternate. If it is individual, then it swing and swing movement. If it work alone on one side, okay, to the contralateral side it swings. Alternate unilateral contraction produces largest lateral chewing and lateral chewing movement. Okay. If it is alternate unilateral contraction, then there will be lateral chewing movement. Just one-sided movement of the lateral pterygoid will cause swing movement to the contralateral side, to the contralateral side. Just action of one muscle on one side, but if there is alternate movement, if there is any alternate contraction, unilateral contraction, then it will cause lateral chewing movement. Okay, so lateral chewing movement by alternate unilateral contraction. Just in a unilateral contraction, swing the jaw towards the contralateral side. Okay, but it opens the mandible, it depresses the chin, it works along with the posterior fiber of the temporalis, it protracts the mandible forward. Okay, we got the lateral pterygoid. Nerve supply is from the nerve to the lateral pterygoid, a branch of the mandibular nerve. So we can say lateral pterygoid, branch of the mandibular nerve. Okay, we got the action nerve supply of the lateral pterygoid. These all are about lateral pterygoid muscle. Now we'll go to the medial pterygoid muscle. Okay. We'll go to the medial pterygoid muscle. Okay. Medial pterygoid should take origin from the medial surface of the lateral pterygoid plate. Okay, origin. Medial surface of the lateral pterygoid plate. Lateral pterygoid plate. We got that. It also takes origin from the pyramidal process. Pyramidal process of the palatine bone. Palatine bone. It also takes origin from the tubercle of the tuberosity of the maxilla. Tuberosity of the maxilla. Okay. So if you go there, here, okay, the lateral pterygoid plate is here. Medial pterygoid should take origin from the medial aspect of the lateral pterygoid plus from the pyramidal process and from the tubercle of the maxilla. Okay, we got that. So the origin of the medial pterygoid. Insertion of the medial pterygoid is to the medial surface of the ramus of the mandible near the angle and below the mandibular foramen. Okay. Insertion, medial surface of the lower part of the ramus of the mandible near the angle of the mandible below the mandibular foramen. Okay, so we can say this is the site of insertion of the medial pterygoid. Okay, so medial pterygoid on this side, masseter on that side. Lateral surface, the ramus, the masseter. Medial surface of the ramus near the angle below this is the mandibular foramen here. Mandibular foramen, below the mandibular foramen and angle. This is site of insertion of the medial pterygoid. Site of insertion of the masseter. Okay, we got that. The insertion of the medial pterygoid. Okay. Now, what is the action of medial pterygoid? Medial pterygoid action of medial pterygoid. Okay. Medial pterygoid, how it works? Medial pterygoid actually elevates the mandible. It elevates the mandible. Alternate unilateral movement help in grinding action. Okay. So, alternate unilateral contraction causes grinding movement. Okay, we got that. So, alternate unilateral activity produces grinding movement, plus it also helps with contributing in protraction. It also helps in protraction of the mandible. Protraction of mandible. Okay, we got it. So we got the origin insertion, origin from the lateral pterygoid plate, from the medial surface, from the pyramidal process, the palatal bone, from the tuberosity of the maxilla, insertion of the medial pterygoid on the medial aspect of the ramus of the mandible, lower part, below the mandibular foramen, above the angle of the mandible. This is the angle of the mandible, this is the mandibular foramen, this is the site. On the other side, we have the muscle masseter. Now we missed one point. What is the action? What is the site of insertion of the lateral pterygoid? it is important to us. We have discussed lateral pterygoid muscle help in opening the mouth. Also, alternate contraction causes the lateral chewing movement. So, what is the insertion of the lateral pterygoid? Okay, we must know that part. Insertion of lateral pterygoid to the fibrous capsule of the temporomandibular joint. Okay, it insertion to the articular disc of the temporomandibular joint. Okay, plus it also inserts to the pterygoid fovea okay, and the neck of the mandible. Okay, so insertion of the lateral pterygoid to the pterygoid. This is the pterygoid fovea. Okay, plus fibrous capsule of the temporomandibular joint and the articular disc of the temporomandibular joint. So, this is the neck of the mandible here. So, pterygoid fovea and neck of the mandible, fibrous capsule, and the articular disc of the temporomandibular joint. Okay, we got insertion of lateral pterygoid muscle. Okay, now we'll go to other accessory muscle. Okay, so accessory muscle essential for opening the mouth. So opening the mouth, yes, we have the lateral pterygoid that opens the mouth. It actually protrudes the mandible, and the posterior fiber of the temporal disc muscle help in opening the mouth. Okay, we have the lateral pterygoid muscle plus some accessory muscles. Okay, like what? The suprahyoid and infrahyoid muscles. Okay, those muscles help in opening the mouth, like as for example the digastric and the mylohyoid muscle. Okay, they help along with other suprahyoid infrahyoid muscle in opening the mouth. Okay, and that's all about the muscles of mastication. If you like my video, please subscribe my channel, support my channel. If you have any question, please feel free to ask me, and have a nice day. Bye now.